So, good day everyone. I am Janice alay-ay from North Valley College Foundation Incorporated, taking up Bachelor of Science in Nursing Section A. So, for today's return demonstration, I am going to perform the female urinary catheterization. So, urinary catheterization is the insertion of the flexible tube or catheter in the urethra into the urinary bladder. So catheterization is usually used to the patient that is having difficulty in urinating. So prior to the conduct of this study, I already checked the doctor's order for me to be able to know that I have the right patient and the right procedure to be done. And also, I already performed a hand washing. This is to lessen the spread of microorganisms and contamination. And also, I already secured all the necessary equipment that I'll be using in this procedure. So that includes the urinary bag, the two-way Foley catheter, and my catheterization set. So without further ado, let's get started. Good morning, ma'am. I am Janice alay-ay, your student nurse for today. So, may I see your wristband, ma'am? Thank you so much. Can you please state your complete name and then your birthday? Okay. We understand that you're having difficulty in urinating. That's why Dr. Tom ordered for you to have a urinary catheterization. So in this process, I'll be inserting a tube on your urethra and connect it to your urinary bladder for you to be able to excrete urine. And also in this procedure, I'll be exposing some of your genital area, and this is a little bit uncomfortable. And also in this procedure, you will be experiencing a painful upon the insertion of the catheter. But don't you worry, because after the procedure, you will be getting relief. So do you have any questions or clarifications regarding with this procedure? Okay. Is it okay if I close the windows and curtains for you to be able to have a privacy? Thank you. So after that, let's proceed to the procedure. So the first thing that we're going to do is to position the patient in dorsal recumbent with a knee flex. This is for good visualization upon doing the procedure. Thank you so much, ma'am. And then the next thing that we're going to do is secure the urine bag behind or beside the patient's bed frame. And then after that, drape the patient, exposing only the area to be used. This is for good visualization upon doing the procedure. So ma'am, I am now going to expose your genital area. So is it okay? Thank you so much. Then, after that, put a pad underneath the patient. This is to protect the bed linen from getting soiled. So, ma'am, can you lift your buttocks for a second? Thank you so much. Okay, the next thing that we are going to do is I am going to provide a direct light for the patient. This is to provide a good visualization upon doing this procedure. Okay, the next thing that we are going to do is I will open my tray, catheterization tray, and arrange it accordingly for convenience and maintain sterility. So what I have in my catheterization set is a sterile forceps, the sterile gloves, the ice sheets, the lubricant, the pre-filled syringe containing of 10 cc of water, the cotton balls. So the next thing that I am going to do is I am going to use a sterile forceps and clean the genital area of the patient. Excuse me. Okay, the next thing that we are going to do is I am going to use this forceps and pick a cotton ball, soak it with a cleansing solution, and then let's line down, then discard, then pick another one, do the same thing, and then discard, and another one, then do it in the opposite side. So be responsible of taking good care of the patient or the equipment that is used in the procedure. This is to maintain the sterility of the surface. And the next thing that I am going to do is I'm going to wash my hands. And I am going to don gloves. So after donning gloves, I'll be putting a eye sheets on the patient's genital area. Okay, the next thing that we're going to do is I am going to insert my catheter with a 10 cc of water or a pre-filled syringe containing of 10 cc of water. Then lubricate the catheter for about 1.5 inches. This is to reduce a discomfort and friction upon the easy insertion of the catheter. Okay, after that, we are going to insert it in the urethra of the patient. So ma'am, I am now going to insert the catheter on your urethra, so just be relaxed and take a deep breath. So inhale, and then exhale. Thank you. So insert the catheter for about 2 to 3 inches or until the urine will flow out. So I can see now the urine. And then after that, rest beside the patient pubis and while holding the catheter to avoid pushing and pulling of the catheter. Then the next thing that we're going to do is I'm going to connect my catheter into the urine bag. Okay. And then Inflate the balloon with 10 cc of water. So the balloon will prevent the catheter from slipping out throughout the parts of the body. Okay. So the next thing that I am going to do is I'm going to remove this eye sheet and dispose it. And also I'll be removing my gloves and dispose and sanitize my hand. And I'm going to clean this area. This is to maintain the sterility of the surface, and dispose it on the disposable bin. So, the next thing that I am going to do is I am going to remove the catheter from the patient's urethra. So, upon removing the catheters from the urethra of the patient, we should stick to the doctor's order if we are able now or we are ready for removing the catheter. So, the next thing that I am going to do is I am going to use another syringe, because that is the syringe that we used earlier is for single use only. So, we will be getting another syringe. This is another portion of my tray. Okay. So the first thing that we're going to do is to deflate the balloon. Easily. Okay. Butter. And then easily pull the catheter. So dispose it together with the urinary bag. Dispose it properly. And I am going to perform a hand hygiene and cover the patient. So, ma'am, what I want you to tell to drink plenty of water for you to be able to have a normal excretion of the urine. So, the next thing that we're going to do is I am going to have a documentation. So, in documentation, we should include the date and time of the procedure, and also we should include the type and the size of the equipment that is being used. So, I used a two-way full-lay catheter with and also a prefilled syringe containing of 10 cc of water, and also include the documentation, the reaction and the response of the patient before doing the procedure, and also include in the documentation the significance of the observation. So that would be all for today's return demonstration. Thank you, ma'am, for your cooperations, and I hope you guys learned from it. So thank you and have a nice day.